Melvin George, and you are watching MG Vlogs. Welcome back to another live streaming. Today's topic is about injection adenosine. Well, it will not be focusing just on injection adenosine and the nursing intervention regarding that. I would be telling you just about a conversation between me and one of my friends. So I am just sharing it on my social media accounts so that my friends and family members may know that I have started my live streaming. So I'll be back in a moment. Back to MG Vlogs, and today have we are going to have a discussion with all of you regarding one very essential condition in medical, that is SVT. Well, main focus of this live streaming is about a conversation between me and my friend. So I would not be telling you his actual name. We will just suppose an assumptionary name, an exemplary name, like if we call it like his name starts with R. So I am just going to take it as Rock. Okay, so his name will be Rock. So whenever I'm going to talk about Rock, that means I am talking about that specific friend of mine. So we had a conversation about one of the medical condition, that is SVT, which is also called supraventricular tachycardia. You may also call it an abnormal heart rhythm. When I say it hard, that means it is associated with cardiac issues or disease. So he is a friend of mine. I'm talking about Rock. Rock is a friend of mine, and I mean, we are friends since more than 8 years. So I saw him. I saw his WhatsApp status, which was stating about his first time experience of giving injection adenosine. Well, I was not familiar that he is giving it for the first time, but later on, when we did conversation on that, I came to know that he had given that for the first time. So his status on WhatsApp was showing just an ECG, that is a wave sort of thing, which is shown on the monitor. So an ECG was showing at the monitor, and the ECG was showing that something abnormally happening with that ECG. And after giving the injection, that is injection adenosine, that ECG somehow changed, that abnormal ECG changed from the abnormal patterns to the normal ECG. So that was something which looks very fantastic, magical, but this was something very much technical that we all have to understand. And that's what I'm going to tell you a little about that specific medical condition, which is also called supraventricular tachycardia or SVT. So, in short, in general, because I know many of my viewers and subscribers, they are not related to medical field, and that is why I don't make more of the videos which are related to medical field or nursing field. I should be doing it, but I don't do it because most of my YouTube subscribers and viewers are not related to nursing or other medical fields. So I would be telling you just simply a little part of that medical condition, which is called supraventricular tachycardia. Well, normally the heart rhythm is normal sinus rhythm. And if we discuss more about this, is that This is something which is generated by the conduction system of the heart, which is simply the impulses, electric impulses generate from SA node to AV node and to Purkinje fibers. And if this thing does not go normally, so there are many other medical conditions that can happen with the heart, but one of those is supraventricular tachycardia, which is a kind of tachycardia. That means in that your heart beats very fast. Your heart beats. Okay, off. Thank you so much for watching it live. I'm sorry I cannot understand Arabic. Well, I love to speak Arabic, but I am learning to speak Arabic. It's a very lovely language, but I don't understand much of that. If you can write those comments in English, so it would be great to read and understand and to talk to you as well. So thank you so much everybody for watching it live. So I have a question for all of you who are watching it live. You just have to tell me what is the reason that most of the medical professional they instruct their patient to cough when the patient is taking, or when an injection adenosine is given to the patient. So that is the main question for all of you. If you know about this question, do answer it in the comment section, or do support this live streaming by commenting anything, any positive views, so that I may improve in the coming days. So let's continue with the conversation. So that is the medical condition, the cardiac condition that is supposed just friendly telling you, or just basically telling you that it is somehow related to the conduction system of the heart. When the conduction system somehow becomes abnormal, so it can cause many health issues, that is specifically the cardiac issues. And one of those cardiac issues is supraventricular tachycardia. Tachycardia is something that is your heart beats faster than the normal beat, and on ECG it shows supraventricular tachycardia, that is called SVT. There are many interventions that are to be taken to resolve that issue. One of those is it's called salva sort of thing, which is that you instruct the patient to to blow the air in opposite direction, or in some resistance. Like if you tell him to blow the air while putting a syringe into your mouth, and try to blow it, syringe without the needle, and try to blow it out, so that you may get some pressure while blowing that air into the syringe. So one of those is that I don't know the exact name of that technique, but it is somehow salva pressure, or salva sort of thing, that you have to blow, that you instruct the patient to blow the air into that syringe. But another thing which is called carotid massage. So this is something I'm not going to go deep in that, but one of that is carotid massage. Your healthcare worker, maybe a doctor or a nurse, is going to do a carotid massage in this region where your carotid vessel is lying. So they will be giving it a carotid massage in this area, so that it will also reduce supraventricular tachycardia, and it may help to cure that. Next is that it can also be resolved with a medicine which is called injection adenosine. Yes, that is something that you must have read on the thumbnail, adenosine. This is what we had a conversation with my friend. So it was about injection adenosine. It is one of the life-saving drugs, and it has to be given to a patient who is having supraventricular tachycardia. So this, how this is given, one injection IV line. So this is specifically for the nurses. One injection, sorry, one IV line is placed over here, which is proximal to your heart, near to your heart. If I go really very simply, just to get you know an easy way to understand. So we will be having one injection, one IV cannula near to the heart, mostly near to this antecubital fossa place. Okay. Somehow into this crease or near to this elbow. Okay, so one IV line, one cannula will be in placed in this area which is near to your heart, and injection adenosine will be given, like for example first dose is given like 6 mg, and it is flushed with around 20 ml of normal saline, that is supposed to use it for flushing that injection because it has a very short half-life, around 6 to 10 seconds. So that means it has to go faster into your body so that it may give you benefit. So this is what normally happens, and the rest is that after giving you that injection, so it is expected that your if the patient is suffering from SVT condition, so his SVT, supraventricular tachycardia, is going to get resolved, and ECG will show normal sinus rhythm. One thing that I had a conversation with my friend, in a very friendly way. So I commented on his status that have you ever seen any healthcare worker, a doctor, maybe a nurse, is instructing his patient to cough while he or she gives injection adenosine? And he was saying, no, I didn't see such condition or such instruction given by any doctor or a nurse that a patient should cough while an injection adenosine is given. So that was the conversation between him and me about that specific procedure, that is to be given to that injection adenosine is given to the patient to resolve that SVT or a kind of a tachycardia. So his name is Rock. That's what I started with this live streaming. I'm not going to tell you the exact name, but his name is Rock. And let's assume his name as a Rock. So whenever I'm going to talk about, so you all who are watching it live, you are requested to type if you know the reason behind why doctor or nurse instruct the patient to cough while injection adenosine is given. So I was talking to him regarding this. Well, even I don't have a written documentary or a written statement about that condition or that rationale, that why most of the doctors and nurses instruct their patients to cough while injection adenosine is given. Maybe, let's assume there is a risk of bradycardia or some other heart issues. So maybe due to coughing, that bradycardia is resolved. That's what is being seen many times. But I don't have the written evidence of that thing. If you guys know what is the rationale behind instructing the patient to cough while injection adenosine is giving, so do write it in the comment section, or you may write anything regarding this live streaming. What I learned from that conversation is that there are many patients who are still suffering from such disease, that is SVT. Well, that friend of mine, he told me many aspects and many many reasons why patients are having such medical condition, that is SVT or supraventricular tachycardia. So I learned a lot about that, and my previous knowledge got reviewed. Whatever I supposed to do in such patients, in such setups where I supposed to practice this sort of thing, or I have seen many doctors giving injection adenosine, so that thing got reviewed. So Matthew Vlogs 18 is saying, hello Melvin bhai, hello Matthew bhai. Today we are discussing about one of the conversation that I had with one of my friends. His name is Rock. That is an assumpted name. His actual name is something else. So this is something related to the medical and nursing thing. Thank you so much for watching it live. So you all are requested to comment about this live streaming, and you can comment about the specific question that I have asked, that what is the reason why doctors tell their patient to cough while injection adenosine is given. So Matthew bhai, thank you so much for watching it live. So Matthew is one of my friends. You all are requested to go and watch his channel. If you haven't subscribed his channel, do subscribe it, and if you haven't subscribed my channel, do subscribe it, so that you may also become a part of my YouTube family. So we are up till now more than 1000, but actual number is more than 900. YouTube is counting them as well who have left us, but YouTube still counts all those who were a part of this YouTube channel. So we are more than 1000 in that sense. So let's continue with our conversation. So the question that people suppose to ask about such topics, that's what I'm going to answer you. So one of the question is, are the topics that men talk about different from the topics women have conversation about? Well, you know what, most of the time when we men's conversate with we do conversation with our friends who are men, we talk something about our profession, and we talk something which is related to sports and going out doing something manly, and which is related to strength. But on the other hand, women's, they mostly talk about makeup, gossips, family things, which they are mostly involved in. Well, men's are not much involved in the family issues, but women's are more interested to talk about family issues. So that's somehow different if we go about the gender discussion. So female talk mostly, female have topic mostly about, so female have most topics about makeup and gossips regarding their families, and regarding some family issues or girly issues. But male, most of the time, they to converse on different topic, like I am sharing the conversation of me and my friend about profession, about nursing care, about something which is related to our profession. Next question is, what topics do men and women talk about? Well, as I already told you, that most of the topics are related to manly thing, strength thing, going out, doing job, earning bread and butter. That's what men are mostly doing conversation all about. But female, they mostly talk about some foods which they are very expert in, and they mostly talk about any gossip regarding any of their family member, specifically their husband and their mothers, their sisters, or people who are very closer to them, or maybe a friend who is a very nice friend to her actually. What do you think of people who do their presentation for the first time? Now, see, today's conversation was all about one of my friends. His name is Rock, the assumpted name, but that conversation was about his first experience of giving injection adenosine to the patient. So I think the way he presented his scenario of giving injection adenosine, he was so much excited. So that is what, whenever someone is presenting something for the first time, that person either he is nervous or excited. But let's take an example of one of my friend. He was so much excited, but many of the people, they get nervous. They get nervous. I believe they should not get nervous. Every time whenever someone is doing a presentation on something, he or she should not get nervous. And let me tell you a tip of not getting, how to get rid of this nervous thing, how you can improve yourself, and you can improve yourself that you would not get nervous anymore. That is, you should be well prepared whenever you are going to give presentation for the first time. It's not only giving the presentation, it's like presenting something for the first time. That's what I believe. You should be well prepared. Try to find out every single solution of the problems. Try to find out every single script that is related to your topic. That's what I'm doing. So today's topic was all about adenosine. I've written many things about adenosine, and somehow I tried to tell you very little about injection adenosine and in which condition that injection adenosine is being given. That must had enhanced your knowledge, as well as it elaborated many aspects of the nursing care as well as the medical care, why people do this, why people give this, and there comes a question for all of you, and I would love to read the comments. If anyone who is watching it live right now or later when you are going to watch this video on this topic, you are most requested to write why most of the nurses and doctors instruct their patients to instruct their patients to cough while injection adenosine is given. So you will have to write the rationale. Well, one of the rationale that I have told you, maybe it is to reduce the risk of bradycardia. Well, there is no such written thing that I have found, but well, that is the assumption that is related to intuition, that is related to insight that I have seen many doctors and nurses while that specific condition is concerned. Well, whenever there is SVT, supraventricular tachycardia, doctor gives injection adenosine or nurse gives injection adenosine, so they instruct the patient to cough, and while you look at the monitor, the ECG is showing SVT, and gradually it goes to normal sinus rhythm, but sometimes it goes to bradycardia as well. And whenever that rhythm goes to bradycardia, doctor instruct or nurse instructs doctor and nurse, they instruct their patient to cough, and when they cough, the bradycardia is resolved to the normal sinus rhythm, or that comes to that comes back to supraventricular tachycardia. So this is something that today's conversation was all about: medical and nursing intervention of a condition which is called SVT or supraventricular tachycardia, which is related to the faster heart rhythm or the faster heartbeat than the normal, in short, in general. So let's just talk more about that friend of mine, how we conversated when we did conversation on WhatsApp regarding this specific topic. So he was so much thankful that his knowledge was enhanced, and he said that he would do more research on this topic, and that's what you and I would have to do. I am also keen to search about the rationale behind this, that why doctors and nurses instruct their patients to cough. If you have the answer to this specific question, do write it in the comment section. Now, let's just talk about one of our friend who was sitting next to him, and while we are doing the conversation, he was also very much thankful that thank you so much for helping me, and thank you so much for helping us actually. So both of them were so much curious to have more knowledge about such procedures and such nursing interventions that they supposed to practice every day. So today we have so much discussed about this injection adenosine, that how is it given, why is it given specifically to the patients who are having supraventricular tachycardia, that is SVT, which is also said to be a heart issue. Commonly, if people who are watching it live or later who are going to watch this video, if they don't know about medical conditions, so this condition is something related to heart, when your heartbeat becomes faster than normal. So in that condition, injection adenosine is being given. So people who are watching it live and have commented, I would like to say thank you all for watching it and commenting. Okay, Auf and Walal, thank you so much, Saiko, for commenting. I'm sorry I could not translate that in English. I don't know how to speak Arabic, but I'm learning. If you can type in English so that I can also understand and my viewers can also understand what have you written in this conversation. And people who know Arabic can also help me to translate this. Okay, auf and walal. What does those both terms mean? So you can help me to while typing it in English, and my viewers can also understand that how people interacted. So guys, you are most welcome to type the specific. Let's just. I would request you all to type a comment as an answer to that specific question, that why doctor or nurse instruct their patient to cough while injection adenosine is being given. Thank you so much for watching it live. If you haven't subscribed to my channel, that is MG Vlogs, do subscribe it so that you may also become a part of this amazing YouTube family. I am a very small vlogger. I supposed to make videos that are related to my occasional routine wherever I go and I talk to people, and that is something related to my experience of talking to people around me. So people like it as well and they support me as well. And thank you so much so far for watching it live. Do comment about today's question and don't feel any hesitation. Just if you want to increase my knowledge, I would love to have it from you guys. Thank you so much for interacting so far. Who have joined us, thank you so much for being a part of this amazing YouTube family. Do go to Matthew Vlogs 18 as well. that person is one of my Indian friends, and he makes very nice vlogs while staying in Kuwait, and he is exploring a lot about Kuwait. So you should also check out on his channel. We have made many collaborative videos, and in future we are also going to make many collaborative videos. And if anyone is watching right now and staying in Kuwait, is most welcome to interact with us. They may comment, and they may email me that they want to have a collaborative video. We will love to collaborate with them, and we will have many fun related activity while staying in Kuwait, and we may explore the beauty of Kuwait as well. So thank you so much for watching it live. Stay blessed, stay happy, and make others happy as well. Do subscribe it and give it a thumbs up if you like our conversation about today's topic. And it was very much lovely to talk to all of you. Thank you so much for watching it live. May God bless you all. May God bless you all, and bye bye. And don't forget to share it with your loved ones. Okay, so bye bye and take care.